Congratulations on the birth of your baby. The following video will provide you with all the necessary information for your discharge home. It will also be available for you to access online at home, so don't worry if you don't remember all of the information.
The day after you go home from hospital, you should expect a visit from a community midwife. If you've not had a visit by late afternoon, please ring the ward to inform us, as it's important that you get this first visit. When the midwife visits you at home, she will arrange the following visits with you. From day 10, the health visitor will make contact with you. It's really important when you leave the ward that we have the correct telephone numbers and address so that midwives know where to visit.
Registering your baby is a legal requirement in the UK, and you have 42 days to complete this from the baby's date of birth. In Lincolnshire, you can do it at any of the county's registration offices. The information is in your red book and also on the QR reader that is on the very front of your red book.
It's important to register your baby at a GP surgery. It is possible to see a doctor before registering your baby, but you will need to contact your local surgery to find out how to do this. It is important to make a 6-week GP appointment at your local surgery. If you have any concerns on leaving hospital, in the first instance, you should contact your GP if it isn't urgent, or contact your local maternity unit.
It's possible to become pregnant again very soon after the birth of a baby. If you need further information, please contact your GP surgery or your local family planning service. It takes time for your body to recover after having a baby, and there are common health concerns to be aware of. This can include conditions such as incontinence, low mood and tiredness, backache, constipation and discomfort to your stitches or caesarean section wound. Please ask your midwife for further information about these or visit the NHS Choices website at www.nhs.uk. It's important to seek urgent medical advice if you experience vomiting associated with a severe headache, blurred vision, pain, swelling or redness in the back of your leg, difficulty breathing or chest pain, sudden heavy blood loss, or signs of infection such as a high temperature, shivering, pain or unpleasant vaginal discharge.
In pregnancy, the baby sits on the pelvic floor muscles. That will weaken them. Then in labour they can get stretched, torn, and stitches and cuts can weaken the pelvic floor muscles further. So it's important after having a baby that you do pelvic floor exercises. To exercise your pelvic floor muscles, you start off by tightening around to your back passage as if you're stopping yourself from passing wind, and then let go. Once you can do that, repeat that by tightening around your back passage and stopping yourself from passing wind, but this time pull upwards and forwards as if you're stopping yourself from passing urine, and then let go. That's a pelvic floor contraction. First time after you've had a baby, it may not feel very strong or not feel like the muscles responding. Keep persevering, the muscles will return, but as I've said, with delivery they have been stretched, so it may take a little bit of time.
Many women feel down, tearful and anxious during the first few weeks after giving birth. This is very, very normal, and we sometimes refer to it as baby blues. The baby blues should not last any longer than 2 weeks. If you feel like your symptoms start or last any longer than this, then this could mean that you're developing postnatal depression. Postnatal depression can develop any time during the first year after you've had your baby. If you have any concerns with this, you should talk to your GP, community midwife or health visitor. Please do not suffer in silence alone.
If you are concerned about your baby in any way, it is important to contact medical advice as soon as possible. If your baby develops jaundice in the first 24 hours after birth or has not passed during within this time, please seek urgent medical advice. Some babies may also develop nappy rash, thrush, constipation and colic. Please see your GP, community midwife or health visitor, or contact 111 for further advice if you're worried about your baby.
Your baby will show signs that they're ready to feed, called feeding cues. This can include waking up, rooting, which is where they move their mouth side to side or lick their lips, sucking on their hands, moving their arms and legs, and also crying.
Feeding can be used at any time to comfort your baby, as a way of spending time together, or whenever mum or baby want a rest.
Keeping your baby close and comforting them will help them to feel secure and will help with their brain development. To help your baby feel secure, keep your baby close to you and feed your baby when they show cues. Talk to and hold your baby and have lots of skin-to-skin contact.
You should always place your baby on their back to sleep and not on their front or side. The safest place for your baby to sleep is in a cot or Moses basket within the same room as you. Make sure that baby's face or head can't get covered while sleeping. Keep baby's feet to the bottom of the cot or Moses basket, with blankets tucked in and no loose bedding. Pillows, duvets, thick heavy bedding, cot bumpers and soft toys should be kept out of the cot. If you do choose to bring baby into bed with you, you may fall asleep and need to consider your baby's safety and reduce the risk. Make sure your baby is not between parents or siblings to avoid suffocation or overlaying, and make sure you have no pets in your bed.
There are certain circumstances when you should never sleep with your baby. Don't sleep with your baby if you've drunken any alcohol or if you've taken any drugs that could make you potentially drowsy. It is important not to sleep with your baby if they were born early, are particularly small, and it is also important never to sleep with your baby if you are sitting in the chair or on the sofa. If you think you might fall asleep, put your baby in the cot or in the Moses basket. Both you and your partner should avoid smoking around baby. Cot death is rare, but it's important to take these steps at each time you put your baby to sleep to prevent the risks. Although having a new baby is a time of excitement, we also appreciate it's a time for adjustment. Make time to get to know your baby and take time out for yourself. Don't hesitate to contact the ward or the community midwives with any concerns or queries that you might have. There's lots of support available once you are discharged from hospital. This includes your community midwife, your health visitor, contacting the wards out of hours, the National Breastfeeding Helpline. There are also lots of local children's centres which run parent groups and breastfeeding groups. You can also access information leaflets and this video, again, online. Lastly, we're always looking to improve our services and value feedback. Your midwife will inform you on how you can provide feedback before you leave the hospital. We'd be grateful if you could take a few minutes to do this for us. Thank you, and congratulations again on the birth of your baby.